Good afternoon, Region 1. My name is Dr. Stephen Chifoon, the Regional Health Officer of the Barima-Waini region, this wonderful place, where we strive to provide high-quality, American standard healthcare right here in Region 1. Let me take you for a tour of the new Port Kaituma Hospital Complex. So we understand that we are in the COVID-19 pandemic, but the COVID-19 pandemic has taught us a lot of things and has filled a lot of gaps that would have existed in our health services. So all patients, all staff, everyone will have to go through a screening process before entering our hospital complex. As you enter into the doors of this new complex, on both my right and left, there are seating facilities for you to wait and a reception area that you can come here now and access your card, your chart, and you will be color-coded so you know which department you go to. As you come through here, the right, you have the outpatient facility. We have 2 doctors that work the outpatient facility, and these are our 2 doctor rooms here, room 1 and 2, and there's another internal waiting area for patients here. Of course, we strive to provide social distancing, and we advocate that all patients, all staff, everyone wears a mask as they enter our facility. This facility is equipped with dressing room for patients that needs to do their daily dressing. We have our dressing room here. The facility also has an indoor pharmacy for every patient that has to receive drug on the ward. These are coded here before they are sent off to the ward. We also have the outpatient pharmacy, the dental unit, and a phlebotomy room to take off samples. Because this is a new purpose-built hospital to bring healthcare to a better quality within the Matakai sub-district and by extension the entire Region 1, we placed a new modern laboratory. This new laboratory is equipped with all equipment to better health services. And when I say to better health services, what do I mean? From next month, when this facility is fully functional, we will have biochemistry, that is your liver, kidney function being done here, your hormone levels for your thyroid, your complete blood work, and every other urine analysis, every other pregnancy related tests, all of that will be done right here in Port Kaituma and by extension, the entire Region 1. This facility is a state-of-the-art facility and it's for you, the people of Region 1. For the first time, the Matakai sub-district is now offering radiology services, X-ray. This is a new state-of-the-art X-ray machine that is installed in this new hospital complex. You now do not have to come till to Mabaruma or go to Georgetown to get an X-ray. You can have that right here at your backyard, at your doorstep. We can do better diagnosis. We can decrease the referrals to Georgetown and we can save money. We can save taxpayers' money, and those monies can be redirected now to developing the region further. We have offices now for the sister in charge of the hospital and offices for the doctor in charge of the hospital. These were never available before, now you have them. This unauthorized area to the public is the wards. Our wards, we have female, male, pediatrics, postnatal, and prenatal ward. Our female ward has 4-bed capacity. All our wards are equipped with sluice sink, washroom facility that are all updated and to the highest standard possible. I would defy anyone to find better health services in a public hospital setting. And I often tell people, our mission is to provide a private hospital care in a public hospital setting. Similarly, our male ward has the same amenities. We have a new design of a nurse's station, granite countertops, well stocked, because we know that our staff matters to us. They're the backbone of the health system. The nurses, they're the ones who hold the system together. And to do this, we want to reward them with a new nursing facility. A facility for them to relax, that's called their nurses' restroom. Just for them. We want them to know that they are special to us. This restroom has sofa set, refrigerator for them to store refreshment, bed for them to sleep in case they want to have a nap if they're not feeling well. And we will be furnishing these rooms further and further. So the new postnatal ward that is in this hospital is equipped with a bed for the mother and a crib for the child, so that any delivery will be done. When the delivery is finished, the patient comes over to the postnatal ward to recover. We know that one of the most common causes of neonatal deaths is when a mother rolls on her child. So that is why we took it upon ourselves to ensure that every postnatal bed has a crib for her child. Our delivery room is also equipped with state-of-the-art facilities to ensure that if we have a baby that's born on flatline or an APGAR score that is very low, we can resuscitate that child, and we also have our incubator. It is the vision of the Department of Public Health to ensure that all specialties are present at this hospital. We already have in plans, before the first half of the year is completed, that we will have a pediatrician, internal medicine specialist, and general surgeon and orthopedic specialist. We know that this area is a mining camp, a mining area, and we will see a lot of infectious disease. That is why this modernized facility has designed its own infectious disease complex. This is an entire building for itself just to house patients who have infectious disease. We also have a new malaria department, and we have also established an environmental health department. Because we see the need, we're the ones in the field. We know that many people are building without knowing the code regulations on how they should build, what distance one house should be from the other. And this is why we decided to invest more in environmental health. The hospital now have a new mortuary. This mortuary facility has 6 refrigerators. We are upgrading from a 2 refrigerator to 6 refrigerator. We have a new kitchen facility and a new administrative complex. But why an administrative complex for a district hospital? Of course, this hospital was built for the future. It was built for your children, for my children, for our children, our grandchildren, for them to enjoy long-lasting benefits of health. And as I often say, good health is the first step to everlasting happiness. I love you, Region 1.
Good afternoon, my name is Jason Ramjan, Medical Laboratory Technician attached to Port Kaituma District Hospital. This is going to make 5 years now. Well, we have challenges, but we cope because our main objective is to ensure that the patient do have the best medical attention when they visit our facility. Well, I'm overwhelmed because the residents of Port Kaituma and the surrounding area will be receiving the services that they would have never received before, because now we have the capabilities to produce the best result comparing to the rest of the facilities in the country. Okay, so we would have received our hematology machine, which we are now capable of doing complete blood count, WBC, and all of these hematology tests. Our biochemistry machine, now we can analyze the biochemistry when the doctor do request. We have a heart enzyme machine, so that would help the doctors. And we have our Chrome machine, which will do LFT, thyroid enzyme.
My name is Genevieve Fernandez, and I'm a registered midwife attached to Port Kaituma Hospital. I'm working in the maternal and child health department. I'm from region number 1. I'm in the profession started in 1996, where I elevate myself from a malaria field worker to a ward orderly, motivated to do the nurse aid program. After that, I went on to do the pre-nursing course, where I was successful and given a chance to do midwifery program, which I was successful in 2008. So I'm in Port Kaituma for the past 10 years. Okay, the transition of the facilities in terms of the healthcare that we would be providing at the state-of-the-art hospital. It is very good. It enhances our healthcare in terms of the delivery process. It is very spacious in the delivery room. In terms of the equipment, we have upgrade with our sluice sink, we have the fetal monitor, we have the neonatal resuscitation incubators. So we are well equipped in order to give a better service to the community.
My name is Ricardo Chan, Environmental Health Assistant, attached to the Port Kaituma District Hospital, serving the Matakai District. The Environmental Health Department is responsible for the sanitation of the community and also the surrounding communities also. Basically what we do is inspections of government places, businesses, residents, and any other consumers or complaints that might come into the environmentally wise, we would look at it. For my job at the hospital is basically taking care of the infectious waste, the sharps and so on. As you can see, we have the incinerator right here. That is what we use for final disposal of all infectious waste, sharps, expired drugs, damaged drugs, and so on.
Hi, good evening. My name is Julian Joseph. I am the pharmacy assistant attached to the Port Kaituma District Hospital. I have been working here since 2017, which is over 3 years. My experience at the old hospital is something that is not very good, but then yet at the end of the day, I feel that there's a saying that what doesn't kill you make you stronger. So all in all, I am very much happy that we are over here, because in this facility here, sir, I'll be able to function properly and execute my duties, whereby at the end of the day, the patient would get one of the best service within the region.
My name is Felicia Abrams, and I'm the dentist that works in Port Kaituma Hospital. I've been here 2 years. My experience has been good. It's was challenging at times, but hopefully here will be okay. It's a good initiative, and I think it will help not only me but also the community to better, and I'm so happy that the dental department can function and do the normal procedure. Yes, the new hospital, especially the chair, will be more functional. We will be offering more dental extraction, dental filling, dental prophylaxis, and that's good.
My My name is Marissa Hudson. I'm a rehabilitation assistant attached to Port Kaituma Hospital. I've been working for the past 2 years. My job entails looking after patients from injuries, CVA, and other rehabilitation. I'm very grateful for the hospital because I will have more space and the patient will be more comfortable from the recovery, and the patient will be more comfortable.
My name is Kenzie Olupin, registered nurse, registered midwife at Port Kaituma District Hospital for over 9 years. We're grateful for this, the new hospital complex, because it's more spacious, it's modernized, because previously where we were housed, it was clustered, so patients weren't happy, likewise staff weren't happy. But in this new complex, we're quite happy with it. The services that is going to be provided to the community is going to boost the health care system, especially primary health care, due to the fact that referrals will be reduced by a great lot, because there's an X-ray department. You're going to have an ultrasound department. We have a modernized labor and delivery department also. So I think this is a great initiative by the Ministry of Public Health.